DRB says, need to post the Dick's name or it will never get better. So I wanted to explain something. So this is, they're suggesting that I post my boyfriend's surgeon's name. He just had neck surgery 2 weeks ago. This is the thing. Doctors are a symptom of a much bigger issue going on that has been created by policies and stigmas from the CDC, DEA, DOJ, and state medical boards. They are who we have to focus on, and they are who we need to get oversight on, because all these doctors reacting in this way of not wanting to prescribe pain medications, fearing to do it, even lying about it, it's because they are scared. They fear they are going to be thrown in jail or lose their DEA license, and I completely understand that. While my boyfriend is seeing the surgeon, I am not going to share his name. The surgery went well. It was a success. So that's not the issue. It's just the after pain care, which prior to surgery, he said, "Oh, don't worry, we will take care of you. You'll be fine." And it's just like it's a whole nother story. So this tells me a lot of things. One, definitely get a prescription written prior to the surgery, because I've heard some doctors say they're going to do it and then they don't. Thankfully, this doctor at least did, but he's said some fibs along the way. And if you look back in my previous videos, you'll know what those are. And to set up a pain management appointment prior to surgery, just in case. And even though my surgeon, when I said that today, giving it a suggestion for patients for future patients for him, he's like, "Oh, most of my patients don't even need this. This is very rare." I'm sorry, but the extent of the neck surgery that he had, and it was a major surgery. And not only that, it's not a one size fits all. Every person is different. Every person, how they deal with their pain is different, and how they react. So when he said that, I just felt like I was gaslit. I do realize surgeons cut. That's their whole thing. They aren't really wanting to prescribe pain medications and get caught up in all that. But, I've had 5 neck surgeries in the past, and my surgeons, this is prior to the opioid epidemic, they gave me several months of medications without any issues. So the whole reason why this is going on is because of the opioid epidemic. And in fact, he even mentioned that today. I was kind to him, but I definitely advocated for my boyfriend, saying, "Look, he has been a monster when you lowered him on the pain medications. He's just not ready yet." I didn't really like that he said, "Oh, well, most of my patients, they're usually off of it within a week." Well, good for them. But you know what? My boyfriend is 65. He's had extensive surgery, and he's not reacting that way. So what? What was your point? I didn't really like that. And I'm venting here right now. But this is what I would have liked to have said to him. Now, doctors, surgeons, whoever, if they put a patient in danger, although this kind of is in danger, or possibly put their... By the way, I'm so sorry. I had a seizure earlier, so like I'm having a little bit of hard time like coming up with words. So FYI, that's why I'm just like But and that's because of all the stress and lack of sleep that I've had. But I definitely do think you should put on Yelp and Google and stuff like that, a 5-star or 1-star or whatever, of how you felt the doctor or surgeon or whoever did. I mean, and for the surgery, he did great. I just really don't like this. So, well, he shouldn't be like that. Now, mind you, this guy, he was in the military. He was a doctor in the military, and he's in the National Guard still. So, I don't know, maybe he feels like tough love or tough it out. But, you know, inflammation and pain are the two worst things that you can do to a patient when they are trying to recover. And that can cause so many more issues. So you bet you I was telling him, like, he needs it. He was a monster when I tried to lower him to the levels that you wanted me to. And he needs a pain management doctor. I don't care the feedback that he gave me. Like, I could give to, you know what. But again, I really want to say, though, and somebody mentioned the other day, oh, you protect doctors and stuff like that. Yeah, you know why? We need doctors. Doctors need us. My goal is to come together and work together, doctors and patients, because we need to. And I mean, what's been going on so far, it's not been working. Doctors, again, are the symptom of a much bigger issue, just like we are a symptom of a much bigger issue. And until we make sure the CDC, DEA, DOJ, and state medical boards, until they are called on this stuff and there's oversight on this, we're not going to change anything. They are purposely making this like this, and it has to stop. Oh, one more thing I wanted to add is he told me after 2 weeks or 2 prescriptions that he writes, it's considered chronic pain. Chronic pain, I thought, or chronic issues. I thought that was like after 3 months. He's like, oh no, it's not. I was just surprised, and I have to check into that because I don't think that's true. And he did write the prescription, so obviously, you know, I mean, we got what we needed and wanted. We have an appointment set up for a pain management doctor for him now. But, you know, it wasn't easy. Definitely, I had to advocate. And that is why it's so important that patients have a person there to help them and advocate for them.